Hola a todos, ¿cómo están? Estamos por aquí un día más con FYM de consultoría de emprendimientos e innovaciones, educación, coaching. Bueno, hoy día tenemos un día muy especial. Uno, porque tenemos a Naomi aquí. Naomi habla inglés, es de África. Y nos va a hablar de un tema muy bonito, que es lo que muy conocido acá en Europa y en todos los países en Latinoamérica también creo que está siendo conocido, lo que es una duola, lo que hace, cuál es el servicio que da una duola a los padres, a las madres, antes de tener en el parto y después del parto. Porque Naomi está con nosotros, hoy es un día especial. Pero no solo por eso, tenemos hoy día una cumpleañera. La corona. So, today, hoy día es el primer día que voy a hacer después de 6 años una entrevista práctica en inglés. No he hecho hace 6 años una entrevista en inglés, no, pero es la primera vez después de 6 años que estoy trabajando otra vez en inglés. 12 años lo hice, lo dejé, y estamos retomando el tema inglés. Así que como salga, pues tendrá que acomodarse. Bueno, Naomi, I was telling to the people that today is my first interview in English. So you are a special guest here. It's a double special day. One, because you are here next to us. So you want to explain to us what is your job, who are you, what is your to be entrepreneurs here in Holland, and the services that you offer for the partners, for the mothers, for the child, and what is Duola actually, because not many people knows what Duola means, especially the Spanish-speaking people. Even myself, I didn't know what Duola was like 6 years ago, and now for me it's a very important, very special work that the people like us Naomi does. So let's introduce Naomi. We met each other. When we met each other? In the Paramana. Yeah, exactly. We did a Duola training with Michel Odent in Amsterdam, and a specialized person. It was a scientist.
Yeah, gynecologist.
Exactly. He had practiced the cesarean for years, right? For years till he became, let's say, he noticed himself that wasn't almost not necessary to have a cesarean for a mother.
Yeah.
So, and he has many books about the child and the mother. He's a German, French guy, and he lives now in London. So Naomi is from Africa, and she has a study in London. And now, because of the love, she is in Holland, in the Netherlands. So let's introduce yourself. Right. I want to introduce more you, but you will do yourself. Tell us, who is Naomi? What is Naomi's bringing for us today? So,
thank you. Hello, my name is Naomi Karemi Kainga. I am a native Kenyan and a British citizen. I've been living in the Netherlands for about almost 8 years now. My daughter is going to be 8 this year. I moved when I was 7 months pregnant with her. Because of love. I lived and worked in the UK for many years until I met the Dutchman, and then I moved countries. So now I'm here. I'm a mother of 2. I'm married to a Dutchman. And I'm a daughter, I'm an aunt, I'm a friend, and a niece, and a wife. And my profession is a birth doula. I do postpartum, hypnobirthing, and bereavement. Bereavement is that I support couples who are going through grief of any magnitude. It might be a child that is known to be dead, or a child that is going to be born but not live long, or a child with a heavy diagnosis and a miscarriage.
Okay, so this is a word that I would like to explain more, and I will do it in Spanish, because that one even myself was asking that's a word I don't know.
Yeah.
Then I went to internet, to
Yeah.
Google, and I found the meaning of
in
this
your
word.
language.
Exactly, in my own language. And
Yeah.
you call it
Bereavement.
bereavement. Okay, so this is to support mothers in difficulties with the child which is has some disease.
Yeah,
say.
sometimes they're born with an illness, which means they will live with a disability.
Okay,
Sometimes they come, but they don't leave the hospital at all, where they pass on.
okay,
And sometimes they've already been dead in the stomach and they have to be born.
yes,
And sometimes it's just a normal miscarriage.
okay. So this is a very important topic because that one was mine topic 5 years ago. Yes, she passed away. She didn't went out of the hospital. And now I will explain in Spanish. Naomi is from England, is from Kenia. She has studied with citizen, con nacionalidad de Londres, de Inglaterra, y pues Naomi está especializada en los cuidados de las madres antes del parto y después del parto. Pero ella también está especializada en cuidar a las familias, a madres que pierden un bebé, como yo lo tuve hace 5 años. Entonces da un apoyo muy especial, o sea, es especializada en cómo ir con estas mujeres que tienen una dificultad con sus niños, ya sea un niño que no va más de 2-3 días, o sea, que se muere, vamos a decirlo, o con un niño que queda, ¿cómo se dice en español? Con dificultades, y pues por toda su vida la madre va a tener que llevar esta vida de un chico o una niña que tenga estos temas, ¿cómo se le llama? Invalidez, vamos a decirles. Y bueno, Naomi es especializada en estos temas. Conocí a Naomi hace 3 años en Ámsterdam, en unos estudios de Michel Odent, que es especializado, es un científico ginecólogo especializado en partos sin dolor y sin estrés. Y pues la persona que se dio cuenta que después de tantos años de cesárea, pues fue consciente de que lo mínimo, o sea, que son pocas las mujeres que necesitan cesárea para un embarazo normal, o sea, para un parto normal. O sea, Michel Odent es vamos a decir, un científico humanista conocido mundialmente, con muchos libros muy bonitos, que por cierto, por medio de él me preparé yo con mi último embarazo, donde fue un parto sin dolor y sin estrés. Por eso me fui a hacer los estudios después. Muy bonito. Entonces Naomi nos va a explicar un poquito más sobre qué es, o sea, cuáles son sus servicios, dónde ella está ubicada y qué más nos puede hablar sobre su profesión. Y lo voy a traducir poco a poco en español, entonces voy a hacerlo en inglés, holandés. Así que si algún error, entiéndame, por favor. Inglés a español, cualquier error, entiéndame. Naomi, sorry, Naomi.
Okay.
I'm sorry about that. I'm saying, and I will try and translate it in English and Spanish. So any mistake,
Yes.
forgive me.
Okay.
Yeah. So, can you explain us, Naomi, and what is your services when the woman is delivering the baby or after delivering the baby? How many weeks before the delivery and how many weeks after the delivery? And what is your services there in those 2 different times?
Okay. As a doula, many couples book me for birth preparation. So you have your midwife who does the medical checks. Doulas don't do medical checks. So we are there to provide the continuous emotional and physical support. So with most of my clients, I see them at least 4 or 5 times, depending on the need of the family. Some couples are very able and they are very prepared, then I see them less. But there is those that really need the support before, then I see them about 4 or 5 times. The 4 or 5 times before the birth is we have meetings at home privately, and I give hypnobirthing courses to prepare the birth. We talk about the physiology of birth, we talk about the process of birth, and it's mainly to bring the man within the whole preparation of pregnancy, because to integrate the man, because it's the men who are lost in the whole package, and even in the hospital they do feel like the third wheel, because there is the pregnant woman, then there is the midwife, and then comes a doula. So then where is my position?
Exactly.
So the main, and my focus really is on the men, because a woman knows what is going on, and they are the lost part. So when I do the birth preparation at home, most of the reviews I've had is fathers who welcomed me very apprehensively, actually, on the first appointment. And by the second appointment, they were the ones who were waiting for me at the door, because they're so excited. They're so excited what we did before, and this realization of, oh, so I can do something for this birth.
It's not
it comes up. It's like an awakening. And it's so exciting to see. So I see them about 5 times. By the time we meet at the birth and the whole process starts, I am not a stranger. We know each other. I've become the best buddy for him. She can focus on herself, and then she will select between me and him who to come in and who is to take a break. So that's the advantage of having somebody else at the birth.
It's very important, very interesting. So actually her focus is not on the woman, but in the men. It is, and this is, if you think now, so exactly, the man is always on the side, because he doesn't have nothing to do.
No, he doesn't have a assigned job. It's the woman who's carrying the pregnancy. It's the woman who gets checked. It's the woman who is looked after by the midwife, and it's only the man who brings the woman to the appointment and takes her home and just nods to a lot of things. But really, it's her body, and any decision that is made is on her. But we want to cut this, it's on you and it's on them, because the baby is for both of them. So that's why I bring them in.
Okay, now I will explain in Spanish. This is very important. It's a very important explanation. So, ¿qué es lo que hace ella? Ella da el soporte, o sea, la ayuda a las madres 4 o 5 semanas antes del parto. Pero, o sea, lo más importante aquí es que no es que ella da la ayuda a la madre, sino que la persona principal a quien ella ayuda es al padre, o sea, a integrarse, a saber que él no solo es para llevar, para coger el automanejar y llevar la mujer al hospital, sino que para saber, o sea, hacerle consciente de cuán importante es el padre ahí, porque el niño es de los dos, no solo de una persona, no solo de la madre. La madre sabe exactamente qué hacer, pero si el padre, porque no tiene esa experiencia, no siente nada en su cuerpo, entonces no sabe qué hacer. Entonces lo que ella hace es que integra al padre en esa preparación del parto 4 a 5 semanas antes. Para cuando ya llegue el parto, él va a saber qué hacer. Ok, no solo estoy para coger el carro y llevar a mi mujer, sino que también para ser parte del acompañamiento durante el proceso. Y eso es muy importante. A los papás que piensan que es solo el trabajo de la mamá, no es verdad. Los padres, tanto los padres como las madres tienen el mismo, no tanto el mismo, sino que es un hijo de 2, no solo de uno. Entonces, eso es lo que nos ha explicado ahorita Naomi, que al final cuando la mamá está en parto, la mujer está en parto, entonces ella decide un rato el esposo, otro rato ella, o sea que es una combinación, no solo el ginecólogo, no solo la ¿cómo se llama? La obstetriz, sino que también la duola, o sea, una compañera, es una ayuda para balancear las emociones en el tiempo del parto, que es un tiempo muy estresante para mucha gente que no está consciente, y ese estrés pues llega al bebé, y al parto también. Si hay mucho estrés, entonces el parto se puede tardar mucho más de lo normal, porque hay mucho estrés tanto del padre, de la madre y de todas las personas alrededor. Es preparación de que todo esté tranquilo, que no hay miedo, no hay pánico, no se necesita más que tranquilidad. Naomi, I have explained now what is your role in 2 or 5 sessions before the birth.
Yeah.
So it's especially with the men.
Yes.
So when the times come, he's also ready to know what.
Yes, he
how
knows what to
behave.
expect and what his position is. It's the
Exactly.
positioning. And we know as couples, I mean, I'm speaking as a couple myself,
So, yeah.
it's so easy during the day to send WhatsApps.
Yeah.
But when that man is in front of you, everybody is busy.
Yeah.
And particularly when you're pregnant, sometimes
Yeah,
you just don't want them in your face.
Yeah.
So having a doula helps a lot, because then when the birth starts, the event exactly starts,
Yeah.
you need somebody else who knows the home, and the only other person who knows the home with a clear conscience at that time
Yeah.
is the father. So he will be the one preparing for everything else that needs to come with us, while the doula is focusing on the mom before the midwife comes.
Exactly. Yeah. Okay. And let's say there is a birth that's you have to go to the hospital.
Mm-hmm.
What is your role there? How will you act in that moment? Being in the hospital can also be that there is a gynecologist.
Yeah.
And also be that there is the other one, the förlossningskonsulent.
Yeah.
And also in this case the Duola.
Yeah. So then the most important part is to actually remember, as a doula, you're always going to be a guest in somebody else's space. And this is a hospital setting. You're entering into a space that is not yours.
Yeah.
She is your client, but this is somebody else's space. And that includes the midwife, the obstetrician, the gynecologist, and everybody else under the hospital. Those who have worked with doulas before, they know that our place is not to be in the middle. We are not on anybody's feet. We're not in anybody's way.
Yes.
Whatever medical need that needs to be done, we step aside and let that happen. And the support is mainly for the husband and the wife. We have no interference with what the midwife and the gynecologist does, because that is part of the reason why I do 5 sessions at home, is to give them a voice, that if anything needs to be questioned with the medical team, they do it themselves. They, meaning the wife and the husband, do it themselves without me being involved. Mm-hmm. If that comes to a point that they have to stand up and question a procedure, mm-hmm. that they would question it in a way that they do not understand, not because they were told to say no.
Yes.
That's not the role of a doula. The role of a doula is not to influence any decisions on a client. It is to educate, so that if they make a decision, that decision is informed.
Exactly. So it's like a footballer playing on the team.
Yeah.
I mean, in the football
ground. Yeah.
It has to be prepared before, but when they are there, they have to make the decision themselves.
Precisely.
Exactly. Yeah. So that is, this is a very important subject, and I will explain again in Spanish because ella está explicando qué es ser una doula durante el parto. Supongamos que es de ir al hospital. Digo supongamos porque aquí en Holanda la mayoría de los partos son en casa. Los partos normales son en casa. Es uno de los primeros, o sea, de los únicos casi países que todavía aplica este método de un parto en casa sin interferencia de nada si está en buenas condiciones. Entonces, Naomi está diciendo cuál es mi actitud, cuál es mi rol, cuál es mi posición durante un parto en el hospital con el ginecólogo, con la obstetriz y con los padres. Como estaba explicando yo también antes, pusimos un ejemplo de qué es cómo se defiende un futbolista en la cancha. El futbolista se defiende en la cancha porque ya está preparado por su coach, por su entrenador. Entonces, Naomi es una coach anticipada para que cuando ellos, o sea, el papá y la mamá esté en el parto, en la hora del nacimiento del bebé, sepan cómo actuar en base a las actitudes, a las opiniones de los profesionales, de los médicos, preguntando todo como no saber, y su decisión será en base a ellos mismos, no en base a lo que Naomi, ella no puede actuar en ese momento, simplemente es una compañera que ya ha preparado, ya ha explicado qué significa todo y qué necesita un niño, un bebé para nacer y para venir al mundo. está totalmente preparada en todos los temas de nacimiento, desde todo. Entonces, eso es una duela, es una compañera, hace apoyo hacia los padres, haciéndolos conscientes antes cómo actuar en ese momento. And Naomi, when you are in the, let's say in the hospital, in the situation, so you are allowed to be in the room with the couples, or
I am.
okay.
Because within those 5 appointments, the first 5 meetings with the couple, there is 2 that I meet them with the midwife. So that when we meet up on the day, we are not strangers also. So they would have met me. And if it is going to be a hospital birth, I would have met the gynecologist also, who is going to be looking after that woman on that day.
Yeah.
So then when I come in, most of them would have already put it in the system that the couple has a doula present. And I've really been impressed how they've welcomed me in a lot of the hospitals. Yes, because when they come, they expect there's going to be a doula. I just have to introduce my name. I've made my own little badges now, so I wear them so they don't forget my name.
Yeah.
And it's quite interesting because even for the midwives, I think it gives them a surety that this woman is going to be looked after by somebody else, and if there is a need, there's always a button that we can call. So then they focus on the others who really need to have somebody with them, who don't have anyone.
Yes, and actually sorry to interrupt you, actually what I just noticed is that the doctors also need you present to help there.
Most of the times, yes, I'm the one picking stuff, and can you pass me this, or can you move this, or
not only on
push
that
this
way,
one.
more to say, okay, our Duola knows more than us.
But I think there is that also.
Because if we think about what does a woman needs to deliver a baby if the baby is in good conditions?
Yeah, they need to be calm.
Exactly, that's it.
Yeah, they need to be calm, and that's why a doula comes in, because hospital with the white coats, it's already intimidating. It can fire you up, especially if you didn't plan to be in the hospital. You either labored at home and then you got transferred in the hospital. Just the sight of the hospital building sometimes is enough to stall a labor. And then there is the going in and meeting somebody who probably had a really rotty shift, who's just taking over.
Yes.
It's nice to have a face that is reassuring, a face that they have known for
It
however
doesn't have
long.
nothing to do
With the protocols and the way the hospital
the rules,
works.
how the hospital, and that's good. They are professional. They have learned how to cut, take the baby out of the belly of the mother when it's necessary, and it is good. But in my opinion, the best birth, the best birth for a mother, if the baby is in a good condition, is at home.
Yeah, we see more of those now.
It's at home because my own experience with my last baby, with Matthias, who now yesterday was 3 years old.
Okay, now.
Yeah, and he was bigger than normal. He was. I had still 3 weeks to go, and he was 4 kilos and 200 grams. And the hospital, the specialist said you have to make a cesarean because this is 3 weeks still to go. And the last time on the last day they grow fast.
Yeah.
And I say to the gynecologist, today he will be born. Mm-hmm. Because my body was telling me. I was feeling that. And what happened, I wait at home on my own. I put in practice all the books that I had read from Michel Odent. And I was I had a doula also. At that time, I had a doula.
Okay.
I was seeing a doula once a month, once per week. No, once 2 weeks. And she supported me a lot. And when you are in the delivery time, so nobody will help you. It's just put in practice. I put in practice what I had read, what the doula told me to do, and till the last moment, I was on my own, and I wasn't feeling any pain. So it wasn't painful, because my time was I feel in my body, and I see what is coming. Nobody
so you go with it.
Nobody was disturbing me because I didn't I didn't ask my husband come and sit next to me or to no. I was just feeling and trying to see what was that. There was the time was 9:30 in the evening, and the midwife called me. Is everything okay? I say yes. I feel like this. I feel like that. Okay, I come to you now. It was almost time to deliver.
Oh.
But and the doctor said you have to deliver the baby here because he's bigger than normally
At the hospital.
at the hospital. Then we went to the hospital, but in the hospital I decided how I wanted to have the room and how many people had to be with me.
Yeah. That's very important.
Yeah, and how many people? Nobody.
Okay.
Nobody. I say to the midwife, I don't want you here. I don't want my husband here. I want to be in my own. And the lights, I would like to have less light than normally. Dark. All the books from Michel Odent were on my head. And oh, sorry. Oh, let me check. Yeah, sorry about that. And when I one moment the midwife came in and she said, "Hey, lie down because you're gonna deliver now."
Okay, so you had already dilated enough,
Everything.
and he was already down.
Exactly. No pain, no stress. Nobody around. As you said, the Duola work is before. It's before.
Yeah.
And it was so nice because within 15 minutes my thighs was ready.
Yeah. And that's the point that I think many new doulas miss. Is there's going to be a lot of disappointments when you start, and I think this disappointment normally that a lot of them don't get. Well, I didn't in the beginning. Is that when you've coached a client for however many months before the birth, and then you miss the birth, of course you're going to be disappointed because everybody wants to experience a new life coming forth.
Yeah.
But most of the times, her capacity to actually deliver, to actually give birth on that time, has been of all the help that you have been able to offer her.
Yeah.
So the fact that she can actually do it by herself is already a plus because you're already a part of that event. I was absolutely heartbroken when I turned up 2 minutes, literally 2 minutes after a birth.
Yeah.
And the 2-minute delay was because I was paying for the taxi downstairs. And I got upstairs and the head was already out. I was absolutely broken. But she kept reminding me, Naomi, I was only able to do this because of how you prepared me. So, of course, you're part of it. And that's another thing, is to actually focus, even for the men, and particularly the men, because there can be quite a bit of... I don't know, some of them can brush the idea off and think, it's okay, we've got this. But nothing beats having a second person in the room with you. That is not part of the hospital. And also, that is not attached to you emotionally. Not your mother, not your sister, not any family. Exactly. Somebody who is not attached to you emotionally, that is going to be walking with you through this journey.
How important are the emotions in everything, especially in the birth? How important is to know what are your emotions, how they work in your life, in the second life is coming also from you.
Yeah.
This is very important. I will explain this in Spanish. Bueno, ahorita vamos a seguir traduciendo. Le he preguntado a Naomi cuál es el trabajo de ella dentro del hospital, o sea, cuál es sabiendo que un embarazo con nada de complicaciones no necesita más que tranquilidad para tener un bebé. Entonces, ¿cuál es el rol de ella? El rol de ella dice que incluso cuando los médicos entran, están felices de verla. ¿Por qué? Porque es la persona principal que sabe qué necesita una mujer embarazada para dar a luz. ¿Cuáles son los servicios? Mantener calma a la madre en base a sus emociones y también al padre, calmados, prepararlos a qué es lo que están pasando, qué está pasando en ese momento y qué puede pasar, no qué puede pasar, sino cómo actuar en ese momento. Y pues sinceramente también expliqué un poco sobre mi propia situación, porque como dije antes, hemos estudiado juntas el curso de Michel Oden, y yo me preparé en el último embarazo con los libros de Michel Oden y con una duola. Entonces, ¿cuál fue mi parto con Mathais, que tiene ahorita 3 años? Después de haber perdido una niña un año antes, fue lo más tranquilo, sin médicos, sin obstetriz, sin nada de ginecólogo. La obstetriz estuvo conmigo solo de vez en cuando, porque yo después de haberme preparado con la duola, o sea, ya tienes ese conocimiento de qué es un parto, ¿no? De qué es lo que tienes que escuchar en ti para sentir, para que puedas detener un embarazo y un parto tranquilo, sin miedo, sin dolor y sin estrés. Eso es, los miedos son los que nos influyen en todo. Mathais, mi hijo de 3 años, con 4 kilos 200 gramos, nació en 15 minutos, después de haber tenido más o menos unas 2 o 3 horas de, ¿cómo se dice? De lo que le llamamos los dolores, que para mí no hubo ningún dolor, nada más fue practicar todo lo que ya había estudiado. Y lo puse en práctica y funcionó. Y es lo que está diciendo Naomi. Cuando una mujer embarazada tiene influencia, que está en parto, tiene influencia de todo alrededor del hospital, de las personas que no me conocen y todos los que vienen y todo, eso retrasa el parto. Si no hay una conexión con la persona que está a nuestro alrededor, emocionalmente en ese momento que nos está ayudando, no, o sea, el parto puede complicarse a una cesárea, a un problema de parto. ¿Por qué? Porque las personas a nuestro alrededor, los miedos se sienten, y el miedo es lo que le transmite uno a la persona y al bebé que está dentro del vientre de la mamá. Entonces eso es lo que dice Naomi ahora mismo, estoy explicando, que es muy importante tener una duola en casa, porque esta duola es la que ayuda a que el parto sea un parto tranquilo, natural, con conciencia y con mucha responsabilidad en ese tiempo, pero responsabilidad de uno mismo. Una vez más, mi parto fue sola, solo los 15 minutos últimos estuvo la obstetriz, no un ginecólogo, obstetriz, con un niño de 4 kilos de 200 gramos. El método de que yo utilicé fue sola, con poca luz, sin ninguna intervención, pero absolutamente en el hospital, sin ninguna intervención. Mi esposo estuvo en el momento que Mathais estaba naciendo. En 15 minutos él nació, 15 minutos máximo que estuvo la obstetriz conmigo. Entonces, hoy este tema es muy importante porque el tema que ella está hablando, yo ya lo sé, o sea, tengo bastante, no lo sé, sino que tengo bastante conocimiento, y eso es parte del coaching, de la consultoría. Cualquier tema nosotros podemos asesorar en cuanto a la salud, porque estamos arriba, no arriba, sino no interferimos en nada en la persona, nada externo, sino en la persona en sí. Y es lo que me está diciendo ahora, me está confirmando Naomi una vez más en base a sus servicios. Naomi, one more question about the process when you are in the hospital with a mother. Tell us about experience where there was a woman that gets, let's say, interrupted.
Mm-hmm.
Maybe toward the medicine, or I don't know. Just tell us an example.
Yeah, there are very many variations. Mm-hmm. And I think the most important bit is to make sure that your birth plan explains the kind of environment you want for your birth.
Exactly. El ambiente es muy importante, en mi propia experiencia, muy importante de decir dónde y cómo quieres, o sea, communication.
Yeah.
It's very important to communicate how I would like to have my birth.
Yeah. So once that is on paper and you have presented it to your birth team, it could be at the hospital or your midwife, your local midwife, they have an idea of how the birthing environment should be, unless it's a red call emergency. So if it's not, then they know how to come in and ask questions, and most of the times questions are directed to the father. The mom is to be left alone, and that is what is normally put on the paper. So the only other person, and this is why I have them meeting at home together, so that he knows his place, and should he then make that last yes or the last nod, that they don't come back home and argue about it.
Yeah.
That last nod was what they had discussed, that if this goes this way, then I want you to be able to do this, or to be able to step in and say this.
Okay.
Yeah.
Okay. So they are prepared beforehand to communicate on how they would like to have the process.
Yeah.
And what they would like to see on that moment, and so they can act on that moment, and not from before, or not to have discussed, and not to be nervous on that moment, not stressed, but to be they are ready to say, this is the way I would like to have it, my birth and my baby to.
Yes, and many hospitals are actually respectful of a birth plan. Many of them really take it to the last word. Sometimes they get dismissed, but it depends on the situation.
Exactly.
But it's really important to already note down and say, look, we know we might end up here. And that's why I make them put it, when they put it down, I always make sure they understand that because you have drawn a birth plan, it's not your definite will.
No, it's because things can be different.
Things can be different,
moment.
exactly.
Yes.
And sometimes they
idea.
change shifts.
Yes.
And if somebody else came that wasn't there 3 hours ago, they can continue the care afterwards, and they just continue from where the other one left.
So, es muy importante comunicar qué es lo que deseas, cómo deseas tener tu parto. Es muy importante que te prepares con anticipación y que sepas qué es lo que puede pasar y cómo actuar en cada momento. Eso es, o sea, en base a las emociones, en base a tu propio sentimiento, y no en base a miedo, dejar que todo pase porque tengo miedo y puede pasar muchas cosas con el bebé en ese momento. Y la única persona que va a estar o sea, vamos a decir, en estrés va a ser la mamá y el bebé. Entonces es muy importante el trabajo de una duola que está arriba, vamos a decirle arriba del ginecólogo, arriba de la obstetriz, arriba de cualquier otro tema, porque es la base. O sea, es la base de todo. Naomi, also Duola, she is the base of everything. Let's say. Yes, exactly, because
I help them prepare for a birth. I mean, a birth is just as important as a wedding. You have to have the right cheerleaders.
This is an example.
Isn't
It's a
it?
wedding.
You focus so much on something. It's comparable to a wedding. You want the best on that day. You're hoping for the best on that day, because you don't know. Birth is an event, and anything could happen. But still, it does not stop, and it should not stop us from planning.
Yeah.
Because once you plan, you look forward to something. And it's very important.
Yeah, okay. That's really very important information. Thank you, Naomi. And the example that you gave today, the birth is like a wedding planning. Yes. It's very nice. It is very nice. So, vamos a hablar un poquito en español. Naomi nos está diciendo que es muy importante prepararse. No, o sea, hacer un plan, pero saber que el plan puede cambiar en cada momento. That the plan can change every time.
Yeah.
You know? And like a wedding plan. Ha puesto un ejemplo de lo que es un matrimonio. Organizar un matrimonio. Eso es de esta manera lo quiero, este es el plan, pero puede pasar cualquier cosa. Es lo mismo. Es lo mismo planificar un nacimiento en base a lo que sabemos, pero preparado para lo que puede pasar. Pero es muy importante de que estemos preparados emocionalmente, mentalmente, de qué puede pasar. Es lo más importante en cada momento. Porque si en ese momento más que todo para los padres nuevos, que no tienen idea de qué es un parto, entonces hay muchos que incluso se desmayan dentro del hospital. O I'm explaining about that. People have to be ready, prepared for a birth, especially the new parents. That sometimes that happen, and I have seen that the parents, they how you say that?
They can underestimate how much of an event birth really can be, and without the right support, it becomes a shock.
They get in shock.
And don't wait to be surprised, because anything can happen. I've had moms who I have supported for the second time, only because for the second time, yes. And when they've booked me for the second time, is because they had a good experience first time. But I've had moms who didn't have a good experience first time without a doula, And the second time they wanted doula, because first time they were either left with their legs up waiting to be stitched, and the midwife had to run to somewhere else. I can't possibly stitch them, but when they see there is somebody else, it eases the whole situation. Even if something was to happen, if they have the right support, everything else is oblivion. Everything else is okay, we can wait.
Even incluso en el segundo parto, ella asiste a madres, porque el primero no fue como ellos pensaban. Entonces es muy importante el Duola, no solo en el primer parto, no solo en el segundo parto, también puede ser en el tercer parto. ¿Por qué? Porque el tercer parto, en base a los niños que ya están, puede ser más estresante todavía. Entonces es muy importante. I'm saying that in the third birth, you can also support the women, because can be also stress.
Yeah.
There are two more babies at home, children at home.
Yeah, and it's a lot.
And the mind of the woman will be okay. During the delivery, can be a stress because of the child at home.
Yeah, and that's where the husband is relieved to look after them, because then the husband knows the children, and then my focus is on the father.
Interesting.
So having a doula is really important.
It's really
for
important.
Anyone. It can be really beneficial to
really
any
important.
couple.
Exactly. So Naomi, tell us, where are you located? Where can people find you? Where is your do you have a place? Do you have a office or place where you can attend people? You just get appointments at home, and then you go to visit the mothers.
Yeah. So most of the couples find me on Facebook and Instagram.
Okay.
And some send meeting requests on my website.
Yeah.
And the majority are from word of mouth, either from a couple that I supported before, then I get referrals back to me. And sometimes it's the midwives who I've worked with before who then think, we could try her if she has space.
Perfect. Naomi, a Naomi la podemos encontrar en su página web. Ella también está en Facebook, en Instagram como UPENDO, ¿no?
Yeah.
UPENDO es el nombre de la empresa, de la oficina, bueno, de sus servicios. Entonces, por medio hay un formulario que hay que llenar para solicitar sus servicios. Por medio de las midwife, ¿cómo se llama eso? Obstetrices también la pueden encontrar. Está ubicada en Leiden, pero se mueve en diferentes países, en diferentes ciudades en Holanda. Así que habla inglés, Naomi habla inglés, habla holandés y habla africano. Your language is?
Swahili.
Swahili. So
I'm from Kenya, so we speak Swahili.
Yeah, Swahili. For people who want to have support in their own language, here is Naomi. In English, here is Naomi. And in Dutch is Naomi. Yes. So, don't forget that no olviden que los temas emocionales influyen en todo. En todo. Para cualquier situación de aprendizaje, para los niños, para los partos, los embarazos, los temas emocionales, mentales, de estrés y emociones tienen mucha influencia. Entonces, eso es nuestro trabajo, asesorar en todo tema que tenga que ver, preparar a las personas a ser conscientes de qué podemos y qué no podemos y cómo podemos actuar en una situación en vivo, vamos a decir, en directo. Bueno, con esto nos vamos a despedir. Vamos a decirle muchísimas gracias a Naomi por más información. Si necesitan más información, por favor, comuníquense con nosotros. We're gonna say goodbye to everyone. Is something else that you would like to say to the people, to the women, especially the mothers and the parents?
Yeah, don't underestimate the value of extra support. Yes. Be it for while you're pregnant, on the birth itself, and after, particularly after. A lot of moms and a lot of dads, they can really underestimate what that life after birth can mean. It is such a life-changing event. The first year of a child can be quite daunting, and having the right support is also very important. And there are so many doulas now who are trained into postpartum support, and you can find them if you do a search. Yes. We have an organization from the NBVD online, and that's from the Netherlands, from the Dutch organization, that is part of the regulation that checks on work ethics of doulas in the Netherlands, and there's so many who are trained and certified, but also student doulas. If you cannot afford to pay a full doula, please go with a student doula. Any kind of support is okay.
So, lo que Naomi nos dice es que no tengan miedo de buscar una doula, de buscar un soporte, de buscar una ayuda, de sentirse apoyados cuando se sientan con miedo, porque eso es lo principal. Aparte hay doulas en todo Holanda, hay doulas que están en estudios, que si no se puede pagar una doula o sea, directo, una doula con experiencia, se puede pagar una estudiante, que ellas también tienen la suficiente preparación para apoyar a cualquier madre. Así que no duden en buscar apoyos, tanto emocionales, tanto apoyo. Todo esto, doula es un apoyo prácticamente emocional, mental. Por algo hicimos el estudio juntas de Michelle Odent, que es muy bueno, por cierto, y ese es el apoyo que nosotros damos en cualquier situación. Ella se dedica específicamente en lo que es las madres y los niños. Pues yo puedo dedicarme a cualquier tema. Empresas, los empresarios con miedo que no saben cómo seguir, los niños, mis temas importantes, los temas a mí me encantan con los niños. Tenemos estudio en todo lo que es life coaching, consultoría, y ahorita tengo también preparada para dar training, o sea, preparación para otras personas. Bueno, con esto nos vamos a despedir. Vamos a decir muchísimas gracias a todos, y pues gracias a todos por las felicitaciones del cumpleaños. y vamos a decir thank you to Naomi for being here. I'm very happy to have you here and to see you again after the study that we have done together.
Yeah,
so
thank you for
it has
having
been
quite a long
time that we have see each other. Yeah. Okay, thank you very much. For any question, for any information, please don't hesitate to contact us. Underneath the video, you will find more information about Naomi, and any services that you would like to have from us. But here we are. Thank you very much, Naomi.
Thank you.
It was nice to see you.
Yeah, you too.
Okay, let's say bye-bye, everyone.
Bye.
Ciao.